This is the Art Beauty Podcast, where we are always reaching for truth in beauty. Remember, the people and the brands on the show are not paying to be here, so we get to ask them the tough questions that we know you want answered because you deserve to be informed so you can make the best choices for yourself. With that said, I'm Amber Milt, and today my fabulous co-host is Dr. Ariel Ostad. He is a triple board certified dermatologist who specializes in Mohs, which is skin cancer removal surgery, and cosmetic dermatology. Welcome to the show. Thank you so much for being here, Dr. Ostad.
Thank you so much, Amber, for having me. It's a pleasure to be here. I'm excited.
So, spring is upon us, and I feel like for people who've been listening, I've been doing this podcast now almost 5 years. Everybody has heard me always say, wear your SPF, wear your SPF, wear your SPF every day, even indoors. I'm wearing it right now. But I think that sometimes reality and the truth can be the best teacher. And I wanted to bring you on today to kind of walk us through, some of the realities of what skin cancer removal surgery, Mohs surgery is like. Not necessarily to scare people into wearing that SPF, but just to kind of give them insight into maybe, you know, the realities of skin cancer and what that's like. So before we even get into that, do you have any statistics on how many people deal with skin cancer every year or are diagnosed with that?
Absolutely. Let's get started with statistics. Generally, it's very well documented that 1 out of every 5 Americans will develop skin cancer in their lifetime. And currently, there's approximately 1.5 million cases of what we call non-melanoma skin cancer diagnosed annually. So that comprises basal cell carcinoma, squamous cell carcinoma, melanoma, which is unfortunately the most dangerous, the deadliest form of skin cancer, happens much less frequently. But ironically, in young women in their 20s and 30s, it is the second most common cause of cancer after breast cancer. So it is something where, unfortunately, has reached epidemic proportions, partially from the fact that we are spending more time outdoors. The sun is stronger due to the depletion of the ozone layer. So it's so important to wear that sunscreen to really help minimize your risk of skin cancer.
Now, and I don't mean to put you on the spot, and it's okay if you don't know this, but how much of this is predetermined by genetics that we're predestined to get skin cancer, and how much of it is really by wearing the SPF and behavioral, minimizing sun exposure and that type of thing?
That's a great question. So I would say to you, easily over 80% of skin cancer is lifestyle related. It's environmental, it's our behavior, it's how we choose to take care of ourselves. I would say to you, less than 20% is sort of predetermined by our genes. Certainly, people who are fair skinned, blonde hair, blue eyes, those are the individuals that get a lot of skin cancer. But I've seen skin cancer in dark skinned people, in Mediterranean, Latinos, African Americans. So the more time we spend in the sun is unfortunately going to lead to skin cancer later. Studies show that majority of skin cancers that happen in our 40s and beyond are due to sun exposure really in our childhood before the age of 18. So our lifestyle choices are so critical.
I mean, I'm thinking back this, to me too now in my mid 40s. I don't think people were as diligent about SPF back then. Although I have to give my mother credit because, we spent a lot of time outdoors and, she would bring us in, at the hottest points of the day and definitely made sure that we did wear sunscreen. But I think now it's really more something that people incorporate into their everyday routines.
Yeah.
Um,
And
you
just to
know,
answer on that,
yeah,
if you don't mind, is that unfortunately, truly 20 years ago, there were not great sunscreens around. And
yeah.
certainly back, if anything, our culture was about really putting like suntan oil. It was about really trying to get that perfect tan. Uh, I remember, like, growing up, people would be sitting with their reflectors and basically suntan oil and trying to get that. So a lot of it is like, I'm glad there's a cultural shift. There's more awareness about the importance of sun avoidance. If anything, back then we used to think sun is absolutely good for you.
Yeah.
Go out into the sun. And sun is an essential aspect of vitamin D production. So it is important to get some sun, but we tend to unfortunately overdo it. So it's important to wear your sunscreen again.
I mean, before we get into, Mohs and what that entails, um, for those of us, listen, I like to go on vacation a couple times a year, and I have to admit it, I like to sit outside in the sun. However, generally, I'll do it under an umbrella with my 50 at least everywhere. But like, how does one balance that? Like, I mean, I know some people who are like, I can't give up the sun. So is there kind of like I don't know, coming from an expert like yourself, is there any sort of like good guidelines that we can follow?
Yeah, yeah, great question. Definitely. I think it's important to validate that sun makes us feel better, right?
Yeah.
It is not only essential for vitamin D production, but psychologically getting sun through our retina, through our eyes, just allows us to, have good feel hormones, whether it's serotonin, whether it's dopamine. So I think it is we can't deny that. And so, but at the same time, what we can do is to sort of create some boundaries about what sun safety is to try to really avoid midday sun, really avoid sun, let's say from the hours of 12 to 5, try to enjoy the sun before 12, before the sun reaches its maximum height in the atmosphere. So go out into the beach, walk around. I think it's important to still wear your sunscreen, get a sort of wide brim hat. Uh, and then try to not be in the sun when the sun is at its strongest. So avoid that midday. And then you can resume back after, let's say, 5 o'clock. Um, a lot of times we do a lot of water sports, and that's kind of a double hit because not only you're getting the direct sun, but you're also getting the sun that reflects off the water. So important to wear that sun shirt as well, reapply
Yeah.
sunscreen, use the right sunscreen. It doesn't mean that you have to be a hermit and hide inside. You can go enjoy yourself, but try to sit under an umbrella and avoid that midday.
Yeah. I mean, everybody, all summer, I will go to the beach, but my husband and I both, like I said, I put on that sunscreen, and you have to do it if you're using a chemical sunscreen. Friendly reminder here, a half hour before you go out. I still fight with my husband because he'll be like, I'll just put it on when I get to the beach. And I'm like, no, by then it's not working unless you've got a good mineral one that will work pretty much immediately. The chemical ones do take a little bit longer. Um, and you can agree or disagree with me, but for me, the sunscreen, any sunscreen you will wear is I don't want to say any sunscreen is a good screen, but whether it's chemical or if you will wear the sunscreen, in my opinion, that's a good sunscreen.
Yeah, totally true. I say the same thing to my patients. The best sunscreen is the one that you like, that you'll use.
Yeah.
It feels good for you and you like it, so you'll use it.
Right.
If it's not going to feel good on your skin, you're not going to use it.
No.
So any sunscreen is better. Ideally, as you said, mineral-based sunscreens are better than chemical-based sunscreens. They just filter out the sun better than the chemical sunscreens. And then ideally, you want to use like something that has an SPF 30 and above.
Yeah. So, you know what? Again, we're going to get into sort of, I think something that's gonna be like a little bit more tough to handle. Before we get there, though, do you have some sunscreens as a professional that you absolutely love?
hmm I like all sunscreens that are mineral-based.
Okay.
Mineral-based zinc and titanium. I have some favorite ones like Elta MD is a really good
Yeah.
one. So I love that product. So truly mineral-based sunscreens are better. There's some controversy about chemical-based sunscreens. Not only you can develop allergy to them, they're not as good filters of the sun. And there's some studies in animals that show that chemical sunscreens can potentially be carcinogenic. So I
Yeah.
usually try to sway my patients to stay away from chemical sunscreens.
Great advice. Yeah, we've had Taizo on here before, which I've talked about. I love
Yeah,
their products. They've got a really great line, mineral line, very wearable products.
I agree.
Uh,
That's a great brand.
so, okay, now we have to get into the tough stuff because I wonder if people don't quite understand. Let's talk about, skin cancer, Mohs surgery. How do people even determine if they have something that needs to be removed?
Mhm. Great question. I think if someone's fair skinned, blonde, blue-eyed, fair skin, has a history of sunburns, I think it's really prudent to get an annual skin exam.
Yeah.
Allow the dermatologist to be the one to check you and know what to look for. I certainly, my intention is never to make my patients anxious, but some commonalities amongst what skin cancer looks like is anything that may look like a pimple that bleeds, that's been around, let's say, for 2 to 3 months. It doesn't go away, it scabs. So anything that's kind of bleeding, anything that maybe like appears like a pimple, it's isolated, it's a single lesion, it itches, or it's maybe a little tender, anything that's scaly and rough. And then certainly any mold that's changing in terms of its color. It has different color variations of brown, black, anything that has irregular borders. Those are some common general descriptions of what skin cancer looks like. But what I would say is if anything looks awkward and it's been persistent, it's so important to go to a dermatologist because early detection is really leads to a cure, especially with melanoma. Because when you catch these things early, they're easily treatable. It's when someone assumes just because there's a bump there and they assume maybe it's just like a mole and it's getting bigger, they ignore it. And then there could be, unfortunately, a huge tragedy where things that could have been treated early is sometimes maybe too late. So I would say it's important in your 20s to start seeing a dermatologist just for an annual exam.
Yes. I got some great advice once, which was be in your birthday suit around your birthday, right? So a great way to remember, oh shoot, did I do my annual exam this year? Is around your birthday. Get into your birthday suit, right? Because you go in there pretty naked and get that full exam.
Yeah.
But it's something that stuck with me and I've never forgotten. I'm go make sure to do that every year, right around my birthday time. So let's can you tell us a little bit about now, let's say we're there, we find something wrong. What are some of the different phases and stages and treatments that are available?
Sure. The different treatment options is really based on the type of skin cancer someone has. Many times patients present with precancers, and that's
Mhm.
an opportunity to catch something before it becomes a skin cancer. Precancers generally either show up as scaly rough spots or a mole that's changing. The treatment for that, if it's a precancer that's scaly and rough, we either kind of freeze it and burn it off. For older patients who have many of them, hundreds of them on their face, there are certain topical chemotherapy creams that work very effectively. There are lasers, or there's what we call special energy-based devices that work quite well for that. For a precancer up to a melanoma, you ultimately have to just remove it conservatively with stitches. Once you have a skin cancer, it's important to determine what type of skin cancer you have. 80 to 85% of skin cancers are what we call basal cell carcinomas, and those appear as little tiny pimples that look like a little tiny bump that just doesn't go away, starts bleeding. About 10 to 15% are what we call squamous cell carcinomas, which are these warty appearing lesions. And then less than 2 to 3% are melanomas, which are these dark, irregularly shaped moles. The treatment options varies based on the type of skin cancer. So basal cell carcinomas that are on the body sometimes can be just treated with burning and scraping them. Sometimes you can just conservatively remove them. Sometimes you can just put a cream on it and make it go away, although that's the least common way of treating it. With a squamous cell carcinoma, because it has the potential to metastasize, it has the potential to travel, you certainly want to be a little bit more aggressive. So you want to get what we call margin control, meaning like you tend to remove it and examine it under the microscope to evaluate the edges, the bottom. It's what we call the margins, to make sure that the cancer is completely removed. So we don't have to worry about it coming back. And certainly with melanoma, the treatment is based on how deep it is. If you
Mhm.
catch melanoma early, you can just excise it with adequate healthy tissue. If a melanoma is more advanced, then unfortunately the treatment becomes much more complicated with not only surgery, but having lymph nodes removed and things like that. So it's really the important thing becomes to catch these things early, because then the treatment becomes just conservative removal. And that's where Mohs surgery comes in, because it's the most ideal, most conservative way of treating these skin cancers.
Now, I do want to give a little PSA here. When I started getting, I've been going regularly to a dermatologist, but I think it was in my mid 20s when I started going. And at the time, I had to have a number of biopsies.
Mhm.
Funny enough, all down my back. And one of the things that I was talking about with my dermatologist, he was like, let's see, when you try to put on your own suntan lotion, like, what's the one area in the middle of your back you can't reach? You're having some issues here. But one of them was, I remember, pretty deep. Luckily, nothing um was positive. But I do have now like a scar because they did have to take out like a good decent chunk. Um,
Mhm.
for those of us who are listening who are still like, I had some friends who had to have them removed on the face. And that can be problematic, right? I mean, just from a cosmetic perspective.
Mhm. Absolutely. So unfortunately, majority of basal cell carcinomas happen on the face. That's an area that's constantly exposed to the sun. So you get that chronic sun exposure. And when it comes to skin cancers on the face, you want to make sure that that cancer is completely removed so it doesn't come back. There are a lot of vital structures on the face, whether it be nerves, muscle, arteries, veins, and you don't want to poorly treat that skin cancer. So the goal becomes, number one, get the cancer out completely. Number two, cosmetically restitch that area, reconstruct that area so that there's minimal scarring. And the ideal treatment option for skin cancers on the face is Mohs micrographic surgery.
Okay. So what is that? Can you tell us a little bit about that?
Sure. Sure. So Mohs micrographic surgery is a treatment that was developed back in the 60s by Dr. Frederick Mohs out in Wisconsin. So it's named after his. It really revolutionized the treatment of skin cancer, because prior to the advent of Mohs surgery, majority of cancers, patients would be admitted into the hospital under anesthesia. A big chunk of skin was removed, which would ultimately leave people with a lot of deformity. He came up with the idea of basically ultimately under local anesthesia, conservatively removing that cancer. The technique has been modified since he basically developed it. But what happens now is in the office, we numb the area locally. The patient's fully awake. We remove that skin cancer with conservative rim of healthy looking skin. The goal is to preserve as much normal skin as possible while the patient is relaxed and sitting in the exam room with a bandage over that area. The skin is basically evaluated under the microscope to check the margins, check the edges, check the bottom. And in the event that the cancer is not removed, we can pinpoint exactly where, in which portion of that skin that was removed still has the cancer in it. Whether it's at the base, whether it's at one corner. If you imagine a clock with the top being 12, the bottom being 6, we can map the tumor to the perimeter of where it's still remaining. And if it's still positive, we go back, the patient is numb, we remove a little bit more, and we repeat that until the cancer is removed. So it's a staged, stepwise fashion of removing the cancer. It allows us to be so precise. The cure rate is 99%. So we get the cancer out. And then at that point, at least we have a wound, what we call a defect, a wound that is as narrow, as small as it can be. So it therefore leads to much better cosmetic outcome.
And then, I'm just imagining, for example, let's say, like I had a girlfriend who had one on her cheek. There is a little bit more fat there to pull together. What about on the tip of the nose or maybe in the forehead? What do we do for those areas, cosmetically
Yeah,
after, knock on wood, and more importantly, the cancer has been removed?
sure. So once the cancer is removed, the next step is this cosmetic reconstruction to put the skin back together, whether it's the nose, as you said, the eyebrow, the forehead, the cheek. There are certain areas like the cheek where there's laxity, you can just pull the skin together and create a fine line. There are certain areas where it becomes challenging due to the lack of loose skin, whether it's the
Mhm.
nose, the lip, the forehead. In those situations, we rely on more advanced reconstructive techniques, whether what we call flaps or grafts.
Yeah.
Uh, uh, Generally, we want to utilize what we call a flap, is where we take advantage of the loose skin adjacent to that wound and free up the skin by making, let's say, an incision from the wound away from that area into an area that's loose skin and freeing up the skin so we can mobilize it better and bring it together. So flaps are like a workhorse in my practice because majority of skin cancers that get referred to me are on the nose. And so it is so important to be able to have an understanding of the anatomy and knowing what type of flap to use. Um, in the last resort, when a wound is so big that you just cannot do a flap, then you do what's called a skin graft. And that's taking skin from another part of the body, whether it be behind the ear, along the collarbone, or in the thigh area, and transferring it into that area. And that happens, unfortunately, when the skin cancer is so large and so wide. Another reason to try to catch these things super early, to, just cosmetically, it leads to such better outcomes.
Absolutely. As I'm sort of thinking this through, and I hope everybody listening at home, that's why I wanted to do this podcast today, not to necessarily scare people, but to just remind you that by getting these checkups, by practicing some sun safety, um, y- y- by catching these things early, like you said, there are better outcomes out there. Um, are there is there any other advice that you have for people? I don't want this to be sort of like a warning, but really more focused on the realities of things we can be doing, things that we should be doing. I mean, I guess we mentioned sun safety, getting checkups. Um, if we think there's something wrong, should we just immediately call a doctor?
I certainly don't want to encourage people to live in anxiety. That's not a
Yeah.
good feeling. So I don't advise that at all. But what I would say is just have mindfulness, to be mindful that if a particular growth on your skin is just getting bigger and it's been there for 2 to 3 months and it doesn't look quite like a pimple and maybe it's beginning to bleed or scab, or it's changing color, and a couple of months has gone by, go see your doctor. So, no reason to get overly anxious. Just be prudent and just go get it checked. So I think just making just a good decision. Um, I don't want our listeners, viewers, to think that there's just a small window of opportunity beyond which, God forbid, people are going to die. That's not the case at all. We run into these horrific, horrible stories where patients die of skin cancer because it was not treated for, let's say, a year or two. So it's not like there's just a small window. That's not the case at all. But that's why ideally get a skin exam once a year. If you see something after 2 to 3 months, just go see your doctor.
Thank you. You actually answered the question I was going to ask next, which is like, how long is that window generally, right? I mean, is it something that's fast? But I gotcha. So certainly, I'm sure for every person, everybody, it's going to be a little bit different. But it's not like if you don't do this today, tomorrow, it could be deadly. But you
Right.
certainly don't want to wait too long. In talking, going back to these Mohs and with some of these things, whether it is a little bit more conservative or something that requires a skin graft, what does that recovery really look like when you see that in patients?
Mhm. The recovery is it varies based on one's perception, to be honest with you. Some people may see it as significant. It really depends ultimately on the size of the skin cancer. But for a majority of people, the recovery is not terrible. There's generally some bruising, so there's generally some swelling. Um, if we do, let's say, surgery on the nose, generally people tend to get a little swelling on their eyelids, on their upper cheeks. There is generally some swelling. Um, there is some tenderness, but it's minimal. We always go through the preoperative plan with our patients to minimize bruising and swelling. So we make them aware ahead of time. We make sure they stay away from blood thinners that can contribute to bruising. Um, we talk about using arnica. We talk about using the appropriate homeopathic stuff to give them sort of the least amount of recovery. But it's not terrible. It's not excruciating pain. But a lot of patients truly do go back to work after a couple of days. Um, Again, it really depends on the size of the skin cancer,
Sure.
but for the most part, there's anticipate some swelling, some bruising. If it's, for example, on their lip is going to get swollen. If it's, near their eyelid, their eye may somewhat narrow and close shut a bit, but usually that goes away in like 2 to 3 days. Bruising takes about a week. Swelling can take about a week or two. Certain times we do flaps where it's much more complicated. For it to look its best, it is going to take about 3 to 6 months. So I always tell my patients, no matter truly where we're doing the surgery and what kind of, whether it's small or not, your ultimate results take really about 6 months, even longer, because it takes that long for your body to go through a healing period and for the inflammation to go away, for the stitches below the skin to dissolve. So it's about really just being patient.
If anybody has come to this podcast by way of like Googling, or maybe they found out that they had something in a tricky area, like the nose, like the cheek, like the lip, and I do know so much of surgery is dependent on the surgeon. So I'm not asking you to make a why I'm asking you to make a blanket statement, but if somebody has had that and they're freaking out, wow, I'm going to have this giant scar. Is it possible to have, skin cancer removed? And is the technology good enough if you're with a good enough surgeon like yourself for it to be something that is going to be unnoticeable?
Yeah, without a doubt. I think if you said it so importantly, it's so important to have a surgeon who has experience, understands the anatomy, um, is quite patient in their meticulousness and is not rushing, and has enough empathy to understand this is someone's face and we want to really do what we can. So it takes all those things. But ultimately, without a doubt, I'm so glad you brought it up. The message that I think it's important to pass on is that Mohs surgery or skin cancer surgery is not going to leave you with a deformity, that the scarring is minimal, that ultimately there are so many people who have had skin cancer surgery and they look great. You can't tell where their scar is. The patient almost has to point it out to you. So, um, uh, what the patient has control over is trying to see a dermatologist as soon as, with an annual exam to minimize the size, and then ultimately choosing the right surgeon who really understands the artistry and the proper way of stitching. And it's remarkable how we do these surgeries and patients are always so grateful that 6 months later they're like, doc, I was so worried, but I can't see anything. I'm so happy. You're always, if you look closely, you'll see something.
Right.
But for the person standing sort of average distance of 2 to 3 feet, you almost have to point it out to someone.
Thank you. I'm sure there's a lot of people who are going to take a lot of solace in that. When you hear something, I'm sure as scary as cancer, there's so many emotions that go along with that. Actually, on that note, do you have any advice for anybody who has been diagnosed with some varying form of skin cancer?
Advice in terms of how to manage emotions or
Yeah.
yeah. So I think it is so important that I try to put them at ease to know that they're not alone. Number one, that it happens unfortunately to so many people, and everybody makes it through, and that they're going to make it through, that they're not going to have deformity, that everything is going to turn out fine, just to be patient, um, and trust their intuition in terms of their interaction with their surgeon, with their doctor, so that they feel that connection, because I think that connection is really important for the outcome ultimately. And just to know that with proper patience and just listening to the doctor, things will turn out fine. Uh, and that all that uncertainty and negativity and fear will eventually subside.
I know that you are based here in New York City, as am I. For people, we've got listeners around the world. If if they are looking for a specialist in Mohs, are there any places that we can go for information? Is it just sort of seeking out individual doctors? Is there any advice for somebody who might not be lucky enough to be here in New York City and get to come see you?
That's great. Absolutely. I would say the sort of premier resource for Mohs surgery is what we call the American College of Mohs Surgery, ACMS. The American College of Mohs Surgery has so much information, videos about what skin cancer is, how Mohs surgery is performed, uh, who are the Mohs surgeons across the United States within each state, within each district of each state. So there's just so much information there where you can find a Mohs surgeon. The other thing that I would say is it's important that also um, your Mohs surgeon is going to do a great job of removing the cancer. Not every Mohs surgeon is a reconstructive surgeon in terms of stitching. So at that point, you want to have an open conversation with your Mohs surgeon about who's going to be doing the stitches. Some Mohs surgeons will refer you out, and some Mohs surgeons will actually with experience, will immediately do the stitching right there, which is certainly much more practical for the patient.
Oh, great advice. I mean, I want to thank you so much, Dr. Osted. You've given us so much information. And of course, if people want to find you, if they're here in New York City, what's the best way to find you?
Thank you so much. So I practice on the Upper East Side. I am on Lexington Avenue and 67th Street. I've been in practice for 27 years. I uh, teach at NYU Langone Health. I teach this surgery to young doctors in training. But I'm here on the Upper East Side, and I'm just so grateful for this opportunity to talk to you about this.
I'm so grateful too. One of the reasons that I started this podcast was to provide information. And again, for everybody listening, this isn't to scare you. I don't want to give you anxiety, but you've heard it from doctors, from experts. Skin cancer can be one of the most deadly, if not caught, but it's also one of the most preventable and, if caught early, treatable.
Yeah,
Is that correct?
absolutely.
So make sure you're going out there, make sure you're wearing your sunscreen, avoiding the sun from 12 to 5, and then, of course, getting those annual checkups. And if you think something's wrong, I always say you got to be your best medical advocate. Make sure to get it checked. Thank you so much for being on with us today, Dr. Austin. I really appreciate all the information that you've given us.
Thank you so much, Amber. Thank you for having me. I think you're a wonderful resource, and I think you're doing incredible things.
Oh. Thank you. Well, if you listening at home have any questions you want me to pass on to Dr. Osted or his team, I'm always happy to do that. You can email me at hello@artbeautypodcast.com. You can find us on Facebook, Instagram, and YouTube at Art Beauty Podcast. And we will make sure to put Dr. Osted's information in the show notes. So don't even worry about that. And of course, we will see you next Tuesday, hopefully being a little bit more sun safe. Bye.